scale, valuation, and speed. But here is the real test of innovation. Does it stay inside the conference halls, or does it actually step out and affect people's lives, touch it intrinsically? The NXT conclave was born out of the very question. It was not designed to be another summit of speeches or an applause. It was created as a platform to discuss, track, and implement ideas that create measurable long-term impact. When we conceptualized NXT, the intention was simple: bring policymakers, scientists, entrepreneurs, and industry leaders into one room, not to exchange visiting cards, but to exchange responsibility, not to admire technology, but to deploy it. On the 1st of March 2025, at Bharat Mandapam, right here where we stand, experts demonstrated AI-enabled breast cancer detection technologies. For many in the audience, it was a breakthrough device. For me, it was a moment of clarity, personally. I must share this before I speak any further, because this is something which was very emotionally attached to me. My elder sister, for about 16 years ago, who herself was a doctor, was diagnosed with breast cancer in the 3rd stage. And this is while she was working at Johns Hopkins. And in spite of the fact that she was a doctor, she had problems in knowing that she was plagued with this problem, with this disease. So in this technology exists, why should it remain confined to hospitals in metropolitan cities? Why should awareness, access, and affordability decide survival? Because in India, the breast cancer is not only a medical challenge, it's also social silence. According to the Indian Council of Medical Research, breast cancer accounts for nearly 28% of all cancers in women in India today. And the Globocan estimates more than 2.3 lakh new cases annually, which also results into about 90,000 deaths every year. Every 6 minutes a woman is diagnosed, every 10 minutes a life is lost. Most cases are detected late, in advanced stages. Survival rates decline, not because science is weak, but because access is delayed. At NXT, we did not want innovation to end with applause. We wanted to travel. That is how Namo Shakti Rath was born. The name Shakti is deeply personal to me, because this is something which I have taken as an inspiration from my mother, and all the motherhood that comes with it, and the power of women. And the larger vision draws inspiration from our Honorable Prime Minister, who emphasized about preventive healthcare, digital transformation, and last mile delivery that has shaped India so far and will become the bedrock of a foundation of a developed India by 2047. So if we want to be a developed country, we have to have an ecosystem which is conducive for healthcare sector, and especially for the people who need it the most. And that's exactly what the Namo Shakti Rath represents: a confluence of personal conviction and national vision. We chose an AI-enabled, non-invasive, radiation-free screening technology, which is no touch, no exposure, no radiation. It uses thermal imaging integrated with AI-based pattern recognition and automated cloud analysis to generate instant digital reports. It preserves the dignity of women, it respects privacy, but the real innovation is not the device, it is the delivery model. On 17th September, this initiative and the Rath was flagged off in Haryana. On 14th January, it was launched in Varanasi. Today, more than 30,000 screenings have been conducted in Varanasi and Ambala alone. Multiple vans. We have about more than 42 of these mobile vans which are operating on a daily basis with a dedicated team, with digital dashboards which track the progress in real time on case-to-case basis. Every participant is registered through secure digital systems. Each screening generates a unique ID, geotagging locations, technician authentication, and encrypted AI reports. This is structured, this is accountable, and it is scalable. This is the AI translated into public health architecture. When a mobile van enters neighborhood, it does more than conduct screening. It breaks stigma, it normalizes conversation, it tells women that early detection is strength and not fear. Earlier, healthcare waited in buildings. Today, healthcare moves on wheels. That is what driving AI impact through real-world action truly means. NXT proved that A conclave can be more than a discussion, it can be a catalyst. It can track ideas beyond the stage, it can convert dialogue into deployment. Artificial intelligence must not remain a lab achievement, it must become a humanitarian instrument. A developed nation is not defined only by GDP growth or digital exports. It is defined by whether its mothers and daughters survive preventable diseases. For me, Shakti is not just a word, it's my mother's blessings. It is every woman's strength. It is the moral force behind this mission. When history looks back at this era, it will not remember how advanced our algorithms were. It will remember whether technology stood with humanity. Namo Shakti Rath is not just a vehicle, it's a moving light, and that light carries dignity, assurance, and hope. I just want to share a few personal instances with you before we start the panel. You know, it was a really heartwarming and a satisfying feeling when you attend these camps, because when people from all walks of life come, I don't think the people working on the project, on the technology, on the quantum aspect or the AI aspect of it would have ever thought that what they are working on will have such a great social impact on Asha Rani in Ambala or Fulo Devi in Varanasi, in terms of what difference it can make. The problem is of awareness as well as the social stigma that remains. While we were curating the technologies, we looked at the Indian problems, the problems that we face in the Indian mindset, which was definitely a big advantage that there was no radiation in this technology, but also the social stigma that came in some parts of rural India was also to be addressed because it was non-touch, non-invasive, and no pain. These are parameters which have helped us expand a campaign and take it to the furthest parts of the country, and which we are expanding on now and taking it to the next level where we are doubling the number of centers. Not only does it provide an alternative to this first step of screening, which is the first point of contact, but also reduces the load on the entire healthcare system to be able to filter in and funnel those cases which have been defined because of the rates of efficacy and specificity, which is about 95% through this technology. So I will not take more time. I will just ask the panel to start the conversation so we can have a dialogue which is more relevant and related to the issue at hand. Thank you very much.
Expo, जिसमें
So I'm going to start off with from Nirmay. I think he will set the ball rolling. If you can put the context as the technology and the thought process behind it, and then we can take it one by one to all our esteemed panelists on the...
Sure. Thank you so much, Sri Kartikeya sir. I will be quickly talking about Niramai and our technology. Just to give a full background, Niramai is the startup based out of Bangalore. It's an AI medical device company. We have built a device called Thermalytics. Niramai is an ISO certified company, ISO 13485, ISO 27001. Thermalytics, which is the main product, is actually being built for breast cancer detection. Thermalytics is registered with CDSCO. This is completely Make in India product, which is very important to talk about it. It's obviously an AI product. And then Thermalytics is also, CE mark approved. The other product which we have for breast cancer is Smile 100, and Smile 100 is US FDA cleared. So we are among one of the pioneers when it comes to AI, having built a device, getting both CE as well as US FDA clearance apart from CDSCO clearance in India. So sir was talking about, Sri Kartikeya sir was talking about, some of the macro, and we were also looking at this, late detection. One of the primary factors is access to screening, as he said, rightly said. Just to give some more numbers to it, while 28% is the incidence rate, which he highlighted, but the screening rates in India is less than 1%. So you look at women population and you look at, the screening numbers in India. So what it means is definitely India needs more innovative technologies to fill that gap. So the current existing technologies are able to reach only 1% of the population. Now, with this innovation, with this campaign, which Sir explained, I think there is a huge potential to reach this to every woman, right? So that is where we are thinking from Thermalytics perspective. And just to little bit click on the product. So the product is absolutely non-invasive. There is no touch involved to the woman. Just imagine a screening room area which is built privately for the woman. Woman enters into it and closes a room. And she is alone inside in front of the thermal imager. And she sits there for 2 minutes. A thermal image is taken which is below the neck and above the abdomen. And that's it. And she comes out, and then her job is over and the report is ready by the time she comes out. So it is as simple as that. Nobody has seen her, nobody has touched her, no radiations at all, and then the report is ready. It is that kind of process that we are talking about. So that's quickly, briefly about the product.
I wanted to ask you, how is it that the Indian, being an Indian company, which is part of Make in India, and how have you taken the sensibility of the Indian context into account, which has been helpful in this campaign? I want your perspective.
Definitely, the perspective is that this no touch is definitely one of the important, aspect. Even if we look at, existing methods, which is clinical breast examination, which is a hand-based examination, which involves touch, and maybe some of the other technologies, which are mammograms, which requires, compression, and it is also restricted to, few hospitals or large hospitals. So access becomes an issue. So in the Indian context, this portable device can be taken to gullies and mohallas and really deep into the communities. And women are, educated through the programs like this, like you spoke about, Namo Shakti, Rath, where the education is provided that there is a non-touch, non-invasive, radiation-free drive is going on. So a lot of advocacy happens through, through this program. And then once women are convinced, they come forward automatically. And we have been seeing, crowds every day in this program because they themselves experience it. Because we believe ASHA workers are the real threats to the to the communities. They can really go deep into the communities.
Anganwadi workers, the ASHA workers.
Anganwadi workers, ANMs, they can connect with communities faster. And once they are educated about this device, it is that simple, non-invasive. They quickly talk more in the community to bring them people.
Yeah. Can I just butt in here a little and to tell you about us at the Indian Cancer Society, where generally it is comprised of volunteers. It's the largest volunteer-based organization. And most of the people who are there working as volunteers, have they themselves been through the process of going through breast cancer or any one of the other cancers. And if they haven't gone through it, well, they have nurtured someone and cared as a caregiver for that individual. So they are very familiar with it. And since the force is comprising of such people who have experienced it and gone through it all, they are made aware of the things by a personal experience right there itself. For example, there's me myself here. I was able to detect my own cancer through a breast self-examination, which I had been hearing people talk about a breast examination. And it was not taught to me by anyone, but I had just read it and heard about it. And lo and behold, I found my own cancer, and it was in the first stage. Now, with this particular device, it is very difficult to check it out in the first stage itself, because a mammogram at least gives you that, the precise thing that, yes, in a way precise, at least 90% precise, that yes, there is a probability of a nodule having developed there, which can be further investigated. But this, so you're groping in the dark for quite a fair time before the lady is actually diagnosed. But yes, what is a good point of this is that it can be done in masses, unlike mammograms, which cannot be done. It's a limited number that can be done. So when you're doing screening on a mass scale, I suppose this is the best way to do it.
Dr. Mandeep, would you like to come in?
First of all, I want to congratulate you. I want to congratulate my Prime Minister. इंडिया का प्रॉब्लम है, इंडिया का सॉल्यूशन है. सबसे बड़ी बात ये है. देखिए, सबसे बड़ी बात ये होती है कि हम ब्रेस्ट कैंसर हमारा सबसे बड़ा कैंसर है. मुझे अर्ली डिटेक्ट क्यों करना है? मुझे अर्ली डिटेक्ट करना है क्योंकि मेरी लाइफ बचानी है. My If I have a stage 1, stage 0, my survival is 80 to 90%. If I have a stage 3, stage 4, my survival goes down. Stage 3, 50%, stage 4, we all know that. Secondly, if I have a stage 0, stage 1, I just need to do surgery. That's it. 50% of it will take hormone tablets. I don't need chemotherapy because 50% of Indian population is hormone receptor positive. Thirdly, if I have an advanced stage, I would be looking at neoadjuvant chemotherapies, mujhe immunotherapy, targeted therapy. Look at the resource which I need to put in for treating such patients. Second, lastly, what I want to say is when I say early stage detection, none of my patients at early stage will lose their breast. That is another big thing. And now coming to the Indian population. Indian breast cancer is not what the American breast cancer is. What you have a solution in America is not what will work here. Mammogram does not work in India, period. The problem is that India, the mean age of incidence of breast cancer in India is 45. When I'm sitting in Delhi, 45 is the mean age of incidence when a woman gets breast cancer. When I'm going to Northeast, that mean age goes down to 35 years. And what is mammogram? Mammogram is X-ray of breast. Why we say that we have to do it at 45 years plus? Because 40, 35, it doesn't work. Why it doesn't work? Because when we have younger females, we have density. The breast density is high. Why? Because milk ductal tissue is high. And when you achieve 45, 45 plus, it's menopause. Milk density goes down. That is when mammogram is effective. So that is the data behind why mammogram is effective in America or UK, because their mean age of incidence is 60 years, 55 years. So that solution will not work in India. This is proven by studies from Tata Memorial. This is proven by studies from SGPCI. Now when I have a woman at 45, what I'm looking at, what is my solution? My solution comes self-breast. My solution comes clinical breast. But more than that, where does Niramaya comes into the picture? It is a thermal image. Now thermal image will detect a neoplastic change or cancerous change. वो जब कैंसर जैसी चीज बढ़ने लगती है तो हीट बढ़ेगी, एंजियोजेनेसिस बढ़ेगा. That is where the thermal image will come into the picture. So thermal image becomes a solution to the Indian problem. It's not that we. So the next part is कि अगर मैंने mammogram कर भी लिया, now I go to a place, I get a mammogram done. I get 100 mammograms done. The problem with that 100 mammograms is that when somebody reads those mammograms, so I need a competent radiologist to read that mammogram. So this is where I think they provide the solution. We are basically supplementing the radiologist with AI. So the best part of Niramaya and AI solution is negative predictive value. I am not looking at positive predictive value. नेगेटिव प्रेडिक्ट मैंने 100 लोगों का निरामया किया, मैंने उनमें से 70% नेगेटिव कर दिए, उनको नहीं है कैंसर, वो घर जाएं. बचे 30. अगर 45 से ज़्यादा है मैं मैमोग्राम अल्ट्रासाउंड करूंगा, 45 से नीचे मैं सिर्फ अल्ट्रासाउंड करूंगा. उस अल्ट्रासाउंड में से मैं वो 5 पकड़ लूंगा जो अर्ली स्टेज पे होंगे. अगर मैं ये नहीं यूज़ करता हूं तो मुझे वो 100 का मैमोग्राम 100 का अल्ट्रासाउंड करना पड़ेगा. फिर मैं मैमोग्राम भी करूंगा, मैं एक रेडियोलॉजिस्ट को भी एम्प्लॉय करूंगा. तो हाउ मच रिसोर्स, हमारे पास ये रिसोर्सेज नहीं है. अभी तक हम इंडिया में जो हम मैमोग्राम्स कर रहे हैं वो हम डायग्नोस्टिक मैमोग्राम कर रहे हैं. डायग्नोस्टिक मैमोग्राम का मतलब ये है कि अगर हम कैंप जाते हैं 90% क्या होता है, अगर कोई लंप है या कुछ है तो इवैल्यूएशन के लिए कर रहे हैं, वो अपनी जगह है. हम इंडिया में उस स्टेज पे नहीं पहुंचे हैं कि मैं स्क्रीनिंग मैमोग्राफी की तरफ आ जाऊं. स्क्रीनिंग मैमोग्राफी के लिए रेणुका जी, उनकी ऑर्गेनाइजेशंस, दे पुट इन लॉट ऑफ CSRs एंड दे मेक अवेयरनेस एंड एवरीथिंग. सो एफर्ट बहुत ज़्यादा है स्क्रीनिंग मैमोग्राफी का, वेयर एज एफर्ट फॉर निरामया इज लेसर. सेकेंडली इट मेरी पॉपुलेशन एट लार्ज को पकड़ेगा. मेरे को 30 ईयर्स पे जो ब्रेस्ट कैंसर हो रहा है उसको भी पकड़ना है, मेरे को 25 ईयर्स पे भी जो हो रहा है उसको भी पकड़ना है, और मेरे को 60 ईयर्स पे भी हो रहा है उसको भी पकड़ना है. और मोर इम्पॉर्टेंट इज, आप ये चीज़ समझो कि 45 ईयर ओल्ड जब हमारी पीक एज ऑफ इंसिडेंस ऑफ ब्रेस्ट कैंसर है इंडिया में अगर लेडी को ब्रेस्ट कैंसर होता है, एक वुमेन को, तो पूरे 3 जनरेशन हिलते हैं. अगर इंडिया में मेल वर्किंग है, राइट, तो वो पैसा कमाएगा. बट अगर जो लेडी है वो अपने हस्बैंड का भी ध्यान रखेगी, वो अपने बच्चे का भी ध्यान रखेगी, वो अपने सास ससुर है उसका भी ध्यान रखेगी, और उसको कैंसर होता है या वो हिलता है तो पूरी फैमिली टूट जाती है। सो द बेस्ट पार्ट इज ये हमको अमेरिका से नहीं मिलेगा, ये मेरे को एआई कोई यूएस वाला बना के नहीं देगा, मेरे को इंडिया में बनाएंगे। इंडिया का थर्मल इमेज है, थर्मल इमेज बहुत दूर बहुत टाइम से था, यूएस को उसकी वैल्यू ही नहीं थी, क्योंकि उसके लिए यूएस थर्मल इमेज उसको लगता है कि नहीं ये मैमोग्राम मेरा सुपीरियर है। अरे यार वो डिबेट सुपीरियरिटी की तो है ही नहीं, डिबेट है एप्लीकेबिलिटी की। मैं इसमें डिबेट ही नहीं करना चाहता कि मैमोग्राम बेटर है, अल्ट्रासाउंड बेटर है, निरामया बेटर है, वो डिबेट नहीं करनी मुझे डिबेट करनी है कि मैं अब अगर मैं मैमोग्राम्स करूंगा तो क्या मैं अपनी जो पीक एज ऑफ इंसिडेंस है उसको मैं पकड़ लूंगा। स्क्रीनिंग का पर्पस ये होता है कि अगर 45 मेरी पीक एज ऑफ इंसिडेंस है, मुझे स्क्रीनिंग 10 साल पहले शुरू करनी है। आई नीड टू स्टार्ट एट 35 मैमोग्राम का रूल ही नहीं है। 35 रोल है किसका है? क्या मैं एमआरआई कराऊंगा सबके? बहुत मुश्किल है। अल्ट्रासाउंड कराऊंगा, अल्ट्रासाउंड में मुझे एक रेडियोलॉजिस्ट चाहिए और दूसरी चीज़ वो पूरा ब्रेस्ट देखेगी। सो दैट इज़ वाई निरामया इज़ अ वेरी गुड सॉल्यूशन, बिकॉज दिस इज़ अ थर्मल इमेज। बहुत टाइम से इंडिया में चीज़ पे काम हो रहा था, इन्होंने वो थर्मल इमेज पकड़ा और थर्मल इमेज पे एआई लगा दिया। तो थर्मल इमेज इंडिया की पॉपुलेशन के लिए बहुत अच्छा है, उसके ऊपर एआई लगा दिया तो रेडियोलॉजिस्ट जो सबसे स्कार्स इन मेडिकल इज़ अ रेडियोलॉजिस्ट। आपको डॉक्टर मिल जाएगा, फिजिशियन मिल जाएगा, आपको सर्जन मिल जाएगा, ऑर्थोपेडिशियन मिल जाएगा, रेडियोलॉजिस्ट सबसे मुश्किल होता है। एंड रेडियोलॉजी इन and Mr. Kartikeya will agree, is the most coveted branch when I give my postgraduate medical entrance. So सबसे जो टॉपर होगा वो रेडियोलॉजिस्ट उठाता है।
I think that's a very valid point, Dr. Mandeep, you made, and I would want to come to Dr. Sandeep if possible on the same issue.
Yeah, so just I want to add, good morning to everyone present here. So I just want to reiterate the idea that in rural scenario, the situation is very different. First of all, resources are problem, and the biggest problem is the stigma. That Dr. Mandeep told, that you tell somebody to palpate or something, वो कहते हैं अभी साइज छोटा है, मेरे घर में तो किसी को कैंसर हुआ ही नहीं, कैसे कैंसर हो सकता है? तो डिनाइल, सेल्फ डिनाइल इज द बिगेस्ट प्रॉब्लम। एंड व्हेन यू रीच टू द कम्युनिटी, you diagnose them, you educate them, and when the people get connected to them, then only they get motivated and they will move forward to the investigation. And I think the best excellent approach with this technique is it is no touch, no see technique. There is no radiation, because the biggest problem is when you ask a patient कि यार आगे further testing कराओ, तो then they are worried about that you have to go in the big machines where the resources are not available. Secondly, nobody wants to get pricked. And the problem, the rule of thumb, what Dr. Mandeep was telling, that early diagnosis leads to cure. Absolutely. When the disease comes late, then the whole trauma comes. एक lady है वो पूरा घर संभालती है. And when
the entire ecosystem
is difficult. And I tell you, when you diagnose a patient and you ask, you come to any OPD, you ask patient to.
या इम्पैक्ट एक्सपो में आपने
दिल्ली से बड़ी खबर आपको बता रहे हैं। आइए, इम्पैक्ट एक्सपो का आज दूसरा दिन है और एक्सपो में राज्यसभा सांसद कार्तिकेय शर्मा शामिल हुए। सांसद कार्तिकेय शर्मा ने संबोधित किया है, ब्रेस्ट कैंसर बहुत बड़ी चुनौती है देश के सामने। राज्यसभा सांसद कार्तिकेय शर्मा ने अपने संबोधन में कहा, जागरूकता की कमी की वजह से ब्रेस्ट कैंसर का प्रसार लगातार तेजी से हो रहा है, इस पर हमें काबू पाना होगा। नमो शक्ति रथ ब्रेस्ट कैंसर की जांच करता है। उन्होंने कहा कि महिलाओं में जागरूकता फैलाई जा रही है। हरियाणा और यूपी में नमो शक्ति रथ चलाया गया। आईटीबी फाउंडेशन के तरफ से यह रथ चलाया जा रहा है। सभी मेडिकल सुविधाएं एआई से जुड़ी हैं। शक्ति मेरे लिए मेरी मां का आशीर्वाद है। राज्यसभा सांसद कार्तिकेय शर्मा ने कहा कि शक्ति मेरे लिए मेरी मां का आशीर्वाद है। नमो शक्ति रथ ब्रेस्ट कैंसर की जांच करता है। और बढ़ेंगे आगे, एक और बड़ी खबर इस बीच आपको बता दें, पंजाब के मोहाली में बम से उड़ाने की धमकी मिली है। इस वक्त की बड़ी खबर आपको बताते चले।